Hey there everybody, my name is Wes and I did my service learning project on the American Heart Association. So what is service learning? Service learning is a teaching and learning strategy that integrates meaningful community service with instruction and reflection to enrich the learning experience, teach civic responsibility, and strengthen communities. It's a collaborative partnership between college and the community. It's applying academic knowledge and critical thinking skills, and it's a reflection and assessment leading to a deeper understanding of course content and civic engagement. So, a little bit more about the American Heart Association. Their mission is to build healthier lives free of cardiovascular disease and stroke. Why I chose the American Heart Association, I have had 3 years of experience as an RN on the cardiac arrhythmia unit located at Penn Medicine, Lancaster General Hospital. I thought having that background would better help me serve the community. So the service learning agreement. So the student objectives was the student will provide 3 common reasons for high blood pressure to participants engaged in health fair events. The student will take blood pressure readings during the 30 hours of service learning located at these health fair events. And after completion of 30 hours of service learning, the student will discuss what blood pressure is, why it is important, and how to make healthy living changes at 3 local events. And lastly, after completion of 30 hours of service learning, the student will be able to discuss 3 common barriers for members of the community unable to meet their target blood pressure. So what can be learned from this experience? The student will learn about a variety of ways to engage with the community. Learning about the healthy and unhealthy habits of the society will give a broader understanding of the people's needs. The student will learn more about risk and prevention strategies as well as dealing with issues such as coronary artery disease, stroke, and many other heart and vascular conditions. So how was this project implemented? So the first thing I had to do, I had to fill out an application. It had all my contact information on it. It had my occupation, services that I did at work, and then services that I could provide, and then my interest in what I'd like to do with the American Heart Association. After that, I received a phone call, and I was emailing back and forth with a representative there, and then we actually met in person at LGH, and we talked about mutual interests and goals and our plans. So the population that was served, so it's people of all ages, senior citizens, children, adolescents, young adults, and middle-aged adults. People diagnosed with CAD, those who suffered from a stroke, those who had an MI, those with hypertension, diagnosed with diabetes, heart valve issues, and heart failure. So some of the population needs were education regarding healthy living behaviors. This included healthy diets, physical exercise, smoking cessation, CPR training, community resources, blood pressure control, and signs and symptoms of a stroke and heart attack. So if you look here on the right, this was one of the papers that we handed out at our stands. It talked about stroke, heart attack, heart failure, kidney failure, peripheral arterial disease. It talked about things that members of the community can do about it, and then it gave resources of where they can get more information. So some of the services that were provided, we shared specialized knowledge and resources to promote healthy living. So we helped the local community manage their blood pressure. We assisted workplaces in offering healthier food and beverage options. We shared healthy living tips, and we performed health screenings at these events. We walked in a local heart walk with colleagues, coworkers, etc., and we raised funds fighting heart disease and stroke. And then we shared the link and demonstrated hands-only CPR to help save a life. So if you look here to the right, this is one of the stands that we had set up. We took blood pressures, and this was actually a scale that would weigh people, and they had to enter their height, and then it would calculate their BMI. And then after they got all that information, we could go over it with them, and we talked about if it was high, low, or normal, and then we talked about strategies to help reduce it if it was high. And then on top of that, we also taught hands-only CPR without mouth-to-mouth. So a lot of people are hesitant out in public, to start CPR on somebody simply because they don't want to do mouth-to-mouth. So what we taught was just doing compressions hard and fast is better than doing nothing. And it's twice as likely to save somebody's life versus not doing anything or waiting until help arrives. So one of the political things that I did during this service learning project was Advocacy Day. We went up to the state capitol there in Harrisburg, and some of the objectives that we wanted to make it mandatory that all Pennsylvania high schools teach CPR. Currently, 38 other states are already doing this, but Pennsylvania is one state that is not. Another thing that we talked about was strengthening the Clean Indoor Air Act, so we didn't want any smoking casinos, clubs, bars, and even healthcare facilities, because that is currently going on, and then it's putting those employees that work there at risk of secondhand smoke. And then lastly, our third goal was to preserve local control and public health policies, such as opposing the preemption proposal, which will prevent local government from enacting a sugary drink tax. So currently in Philadelphia, they're taxing sugary beverages. So it's a little bit more expensive, and the idea is to prevent people from buying sugary drinks, which can cause diabetes and obesity, and buying healthier drinks with less sugar in it. And the idea is to prevent the state and federal government from overreaching and enacting laws that would prevent local government from doing this. So here to the right is a picture of all of us on Advocacy Day. So some social issues. Currently here in Lancaster, 10% of adults have diabetes, 16% smoke tobacco, 29% are obese, and 20% are physically inactive. So the Heart Walk was one way to make people aware of living a healthy lifestyle to help prevent acute or chronic diseases such as coronary artery disease and stroke. We want to help promote healthy living in the community. Some cultural and economical issues. So vulnerable population is minority groups with a low socioeconomic status. These people have many health risks discussed earlier. These groups of individuals are associated with lower overall healthcare usage and access. Data suggests that up to 30% of non-white persons younger than age 65 years old are less likely than their white counterparts to be insured. In addition, the poor were 24% more likely to be uninsured versus middle to high-income individuals. Some challenges faced by these individuals are having access to health care. A higher number of these people have low income, less education, special needs defined by disabilities and chronic diseases, and no health insurance coverage. This population of individuals work in job environments that pose greater health risks with lower wages and no benefits at all to health insurance. So one of the things that we could do about this was promoting healthy living, so making people more involved in their own care, eating a healthy diet, avoiding smoking and excessive amounts of alcohol, getting adequate sleep, exercising daily. These are all ways to help prevent chronic diseases down the road and staying out of the hospital. So if you look here at our stand, we're handing out cooking healthy recipes that people could cook. We handed out heart healthy snacks, and we talked more about blood pressure control and monitoring that on a daily basis or weekly or monthly. So one of our stands was located at the McCaskey High School. They had a fair event going on all week, and I've noticed the urban cities have a lot of minorities of lower socioeconomic status, and you may have noticed already, but there's a McDonald's sitting right on the corner of McCaskey High School, and a lot of the kids right after school will go right to the McDonald's. I mean, it's easy access, it's good, it's cheap, and that's an issue. And we're finding out a lot of kids are getting obese, and then a lot of adults are obese, and they have high blood pressure, and they get these coronary artery disease and stroke and many other health problems. So we were trying to make people aware of that, and we were handing out a lot of heart healthy snacks that day and a lot of brochures to send out our message. So some of the things we talked about that we educated, risk factors for developing CAD, such as older age, family history of CAD, race, such as African Americans, being at higher risk than anybody else, high cholesterol, diabetes, physical activity, smoking cigarettes, high blood pressure, stress, and obesity. These are all risk factors. And then, again, we talked about not smoking because it can cause your vessels to harden and constrict. It can make your heart beat faster and your blood pressure will go higher, and then plaque will build up in your arteries. We talked about how exercise can help strengthen the heart and lower your blood pressure. It can help control diabetes, and it's even been proven to prevent depression and reduce anger and stress. We talked about eating more fruits, vegetables, lean meats, whole grain, and fish, and then avoiding foods high in white flour, sugar, and fructose, and corn syrup. And if you're still having high blood pressure, you should follow up with your doctor and talk about maybe getting on a medication so you don't have more issues down the road. So I would say all my objectives were met. We discussed many causes for high blood pressure. We were able to take many of the community members' blood pressure readings at all the events that we had. I was able to explain to the community members that high blood pressure is a risk for CAD and stroke. And then I was able to explain healthy eating habits, smoking cessation, avoiding alcohol, getting adequate sleep, losing weight, exercising, and minimizing stress as all strategies to lower blood pressure. And then I was able to identify some barriers for people to lower their blood pressure, which were unhealthy eating habits, there was a lack of education, and then there was a lack of follow-up with healthcare providers. Many people said they haven't seen their family doctor in years. So the impact on the population served. So many members were grateful for the healthy diet recipes that we handed out. A lot of the children at the health fair events got a taste of a heart-healthy snack. Many parents and their children are able to demonstrate adequate hands-only CPR. The House bill regarding mandatory CPR passed the House committee and is currently being reviewed by the Senate. And then individuals were made aware of their high blood pressure that they didn't know they had, and then they were educated of the risk. They learned healthy living behaviors, and they were given the opportunity to ask questions and voice their struggles with living a healthy lifestyle. So personal reflection, it was an eye-opening experience for me. It made me more aware of the community needs, and I was engaged as a member of the community, and I felt like I was able to give back with the use of my professional abilities and knowledge. This is me and my girlfriend at one of the American Heart Association events at the Lancaster Country Club, where we got to raise funds that went towards CAD and stroke. Professional reflection, so it gave me more of an insight on the community needs, and then it made me more aware of how I can help as a nurse at the patient's bedside. I was able to advance my knowledge in public health and teaching, and it allowed me to be a positive influence in the community. And it also gave me a voice in politics to look out for community members and voice everybody's concerns. And this is the Capitol here, and this is the room that we had our meetings at, and this is our stand that we had set up that was advocating for CPR in all high schools and getting rid of smoking in bars, casinos, etc. So one of the project revisions and considerations for the future, I thought it'd be cool to make this whole project a group project. It would have been cool to share this experience with a friend of mine that I work with or am going to school with, but I know that could be hard, but it's just an idea. And then another thing I thought would be good for the future is getting examples of foods high in sodium, saturated fats, and trans-saturated fats so members of the community know what not to eat. Or even bringing food labels to educate the community members on how to read them, because not many people understand these labels, like how many serving sizes are in one package. Like this is one serving size here. So I thought that would be a good educational opportunity. And then lastly, I thought it would be good to discuss more about serving sizes and portion control. And that is it. And here's my references, and thanks for listening.